We can contrast the t-learner with another method for making this estimation, and that is to use a single model, mu hat, for estimating both these expectations. In the single model, the treatment is an indicator which can take on 0 and 1, which is used as a feature in the model, similar to all of the other features like age or blood pressure. Now, to get the expectation of the outcome under treatment, we estimate mu, setting W equals 1. Similarly, to get the expectation of the outcome under control, we estimate mu, setting treatment or W equals 0. We can then take the difference in these two estimates. This method is called the single tree method or the S-learner. We learn the model mu using randomized control trial data of both patients included in the treatment and in the control arm. Once again, we can split the data into a training set and a validation set to learn a model that generalizes. The learned model is now a single decision tree instead of two decision trees. Notice that this decision tree contains branches which contain both the patient features and whether or not a patient received treatment. Using this model, we can now estimate the treatment effect for a new patient. For this patient with age 56 and blood pressure 130, we can first find their expected outcome with treatment to get mu hat x, 1. So we first go down the blood pressure branch. We see that their blood pressure is smaller than 140 and their age is smaller than 60. We're now looking at the treatment arm, so our treatment is set to 1 and our estimate is 0.4. We can then find their expected outcome without treatment. We first go down the same blood pressure branch. We also go down the same age branch, but now our treatment is 0. So we go here and find the expected risk of 0.5. We can now take the difference in these two expected outcomes to get the treatment effect estimate of 0.4 minus 0.5, which is negative 0.1. The disadvantage with the S-learner is that we might learn a tree that may decide not to use the treatment feature at all. If we don't have the ability to force a decision tree to use the treatment features, we might still get a tree that makes a very good estimate of the expected outcome for a patient under both treatment and control. However, the problem is that such a model would produce a treatment effect estimate of 0 for everyone. For instance, with the same patient as earlier, we would make an estimate of 0.45 under treatment and under control to get an estimate of 0. This will be true for all patients, thus making this tree not a very good treatment effect estimator if there do exist effects on individual patients. The t-learner, on the other hand, uses two different models and is less likely to have this problem. However, note that because each model in the t-learner is using half the data, there is less data available to learn the relationships between the features. The T or S-learner methods are some of the simplest of many possible methods we can use to make an estimate of the individual treatment effect using a patient's covariates. These personalized treatment effect estimates might be more useful for making individual treatment decisions than the average treatment effect for a treatment.